Good morning. Welcome to our Residency Summit meeting. My name is Harold Schoenhaus. I want everybody to enjoy the agenda that we have set forward. It will be most educational, somewhat interactive with question and answer sessions, and an opportunity to visit our sponsors.
We're going to be talking about pH and changing the dynamics of wound healing to advance clinical outcomes. My name is Matt Garafalis, and I'll be giving you this presentation to go over some interesting ideas on how to get this done.
My name is Alton Johnson. I'm currently a clinical assistant professor here at the University of Michigan in Ann Arbor. Today's lecture will be Introduction to Financial Literacy for Young Physicians.
My name is Jaminelli Banks. I am faculty and staff at White Memorial Medical Center. The title of my presentation is The Keller Arthroplasty. This is my personal experience using this procedure in treatment of patients with chronic hallux ulcerations.
Hello, everyone. Welcome and good morning. I'd like to, at this time, present what I think is a very important talk and area of practice, and that is for diabetic foot ulcers.
Well, hello, my name is Dr. Marie Williams, and I'm going to talk to you about posterior tibial dysfunction today. Posterior tibial tendon dysfunction has many etiologies. Some of the most common are trauma, inflammatory diseases, degenerative diseases of the tendon.
Dr. Sherman, do you have any questions for the panel?
I sure do. A few questions for Dr. Domenico that were submitted during his presentation. What pain management protocol do you have for these patients, and how is their pain response on follow-up after the total ankle replacements?
Thanks, Alan. Typically, I'll either order a preoperative pop lock, from anesthesia. If I don't give that, or the patient doesn't request that, then I'll usually use 30 cc's of 0.5% plain Marcaine as an ankle block, as a more regional or local anesthetic.
We paid special attention to the exhibit hall experience here at this virtual conference. Learning from the companies that provide products and services for you is part of how do you keep current and continue to provide the best care for your patients and to run your practices most efficiently and profitably. We're utilizing a convenient and easy to use attendance verification survey to confirm your attendance for CME purposes. It's the equivalent of being scanned for CME when you attend live conferences. The 19th Annual Residency Rumble. This is an academic game show consisting of 60 case-based questions generously provided by the American Board of Podiatric Medicine. We'd like to thank ABPM and Orthodontics for sponsoring the Rumble this year.